Right now, somewhere in your home, there is a small bottle. It might be in your bathroom cabinet, your kitchen drawer, your purse, or sitting right on your nightstand. You have probably reached for it dozens of times without a second thought. A headache after a long day at work? You reach for it. Your back hurts after yard work? You reach for it. Your knees are sore after a walk? You reach for it. It is one of the most purchased products in every pharmacy and grocery store across America. Millions of people take it every single week, some every single day, completely convinced it is harmless because it does not require a prescription. But what if I told you that this small, ordinary pill that you have trusted for years is doing something to your blood pressure that your doctor may have never clearly explained to you? What if the very thing you are taking to feel better is silently making one of the most dangerous conditions in America significantly worse? Stay with me through this entire video, because by the end, you are going to look at that little bottle very differently. My name is William Hart, and I have spent years studying cardiovascular health and the hidden factors that drive blood pressure to dangerous levels in millions of Americans who have no idea why their numbers keep climbing. And one of the most consistent patterns I have seen in the research, one that does not get nearly enough attention, is the direct, documented, scientifically proven connection between common over-the-counter painkillers and elevated blood pressure. This is not a fringe theory. This is not something I am speculating about. This is backed by decades of research, acknowledged by the American Heart Association, and yet somehow, millions of people are still reaching for these pills every day without any awareness of what they are doing to their cardiovascular system. Today that changes. Let us talk about the specific category of painkillers I am referring to, because I want to be very precise with you. The drugs in question are called NSAIDs, non-steroidal anti-inflammatory drugs. You know them by their brand names: Ibuprofen, Advil, Motrin, Aleve, Naproxen. These are the pills that are sold in massive bottles at every Costco and Walmart in the country. The ones that are advertised during football games and morning news shows. The ones that are so normalized in American culture that people take them the way they drink coffee, automatically, habitually, without a second thought. And I want to be clear, I am not here to tell you these medications have no value. For short-term use in healthy individuals, they can be effective for pain relief. That is not the debate. The debate is what happens when they become a daily or near-daily habit. And what happens is something that your blood pressure cannot afford. Here is the mechanism, and I want you to understand this clearly because once you do, everything will make sense. Your kidneys play a critical role in regulating your blood pressure. They do this partly by controlling how much sodium and fluid your body retains. When you take an NSAID, it inhibits the production of certain compounds in your body called prostaglandins. Prostaglandins help your kidneys filter sodium and maintain healthy fluid balance. When NSAIDs suppress prostaglandins, your kidneys begin retaining more sodium and more water than they should. More fluid in your bloodstream means more volume pushing against your artery walls. More volume means higher pressure. It is a direct physiological cause and effect, and it happens every single time you take one of these pills. Not occasionally. Every time. But it gets more serious than that. NSAIDs also cause your blood vessels to constrict, to narrow. Think about what happens when you squeeze a garden hose while water is flowing through it. The pressure increases immediately. That is essentially what these medications are doing to your blood vessels. They are causing them to tighten at the same time they are increasing fluid volume. So you have more pressure and less space for it to move through. For someone with normal blood pressure, this effect might be temporary and relatively mild. But for someone who already has elevated or high blood pressure, this is like pouring gasoline on a fire that is already burning dangerously close to something catastrophic. Now let me share some research with you that I think every person who takes these medications regularly needs to hear. Studies have shown that regular NSAID use can raise blood pressure by an average of 5 millimeters of mercury. That might sound small to you, but in cardiovascular medicine, 5 points of blood pressure elevation sustained over weeks and months translates into a measurable increase in heart attack and stroke risk. And in people who already have hypertension, the effect is even more pronounced. Research published in major cardiology journals has found that people with high blood pressure who regularly take NSAIDs have significantly worse blood pressure control than those who avoid them, even when they are taking the same medications, eating the same diet, and following the same lifestyle. The NSAID is quietly undermining everything else they are trying to do. It is like trying to empty a bathtub while someone else keeps turning the faucet back on. And here is something that makes this problem even more insidious. The people who are most likely to reach for painkillers regularly are often the exact same people who are most vulnerable to the cardiovascular effects. Think about the typical profile: someone in their 40s, 50s, or 60s dealing with chronic joint pain, back pain, or arthritis. They are already in an age group with higher baseline blood pressure risk. They may already be on blood pressure medication. They reach for ibuprofen because their knees hurt and they want to keep moving and stay active. Their intentions are completely good. But what they do not realize is that the ibuprofen they are taking to manage their pain is making their blood pressure medications significantly less effective. Some studies have found that NSAIDs can reduce the effectiveness of multiple classes of blood pressure medications, including ACE inhibitors, ARBs, and diuretics, by interfering with the same kidney pathways those medications rely on to do their job. So the doctor prescribes a blood pressure medication. The patient takes it faithfully, and then takes ibuprofen for their back pain 3 times a week. And their blood pressure stays stubbornly high. And nobody connects the dots. I want to pause here and ask you something directly. If you are currently taking blood pressure medication and your numbers are still not where they should be, have you ever tracked how often you are also taking ibuprofen or naproxen? Have you ever mentioned to your doctor exactly how frequently you use over-the-counter pain relievers? In my experience, this conversation rarely happens. Patients do not mention it because they do not think of it as a medication. They think of it as something you just take when you hurt. And doctors, in a 15-minute appointment, often do not ask the right questions to uncover this pattern. So the blood pressure stays elevated. The dose gets increased. And the ibuprofen keeps quietly working against everything. Now I also want to address something important. Because when people hear information like this, sometimes the reaction is to think that the solution is simply to switch to a different painkiller. Specifically, many people believe that acetaminophen, Tylenol, is a completely safe alternative for people with high blood pressure. And while it is true that acetaminophen does not carry the same fluid retention and blood vessel constriction risks as NSAIDs, the research on acetaminophen and blood pressure is more complicated than most people realize. Recent studies have shown that regular high-dose acetaminophen use may also be associated with elevated blood pressure, particularly in people who already have hypertension. The effect appears to be less dramatic than with NSAIDs, but it is not zero. The message here is not that one pill is perfectly safe and another is not. The message is that no painkiller should be treated as a harmless daily supplement, especially when you are trying to manage your blood pressure. So what should you actually do with this information? Because I understand that pain is real and it needs to be managed. I'm not asking you to simply suffer through legitimate pain without any relief. What I am asking you to do is approach pain management with the same seriousness you would apply to any other factor that affects your blood pressure. The first step is awareness, and you already have that now. The second step is having an honest, detailed conversation with your doctor about how often you are using over-the-counter pain relief, which products specifically, and what alternatives might be appropriate for your situation. There are pain management strategies that do not carry the same cardiovascular risks: topical anti-inflammatory creams, physical therapy, targeted stretching programs, certain supplements with anti-inflammatory properties, and your doctor can help you build a plan that manages your pain without undermining your heart health. The third step is monitoring. If you use painkillers even occasionally and you have high blood pressure, start tracking your blood pressure readings in relation to when you take these medications. Check your blood pressure before taking a painkiller and then check it again 12 to 24 hours later. You may be shocked by what you see. This kind of personal data is incredibly powerful, both for your own understanding and for having an informed conversation with your healthcare provider. I also want to address something that I think is a genuine gap in how this issue gets communicated. The warning labels on these medications do mention cardiovascular risks, but they are written in small print, in medical language, buried among a dozen other warnings, and most people simply do not read them. The fact that something is sold without a prescription does not mean it is without consequence. Over-the-counter means accessible, it does not mean risk-free. Aspirin, ibuprofen, naproxen, these are real drugs with real pharmacological effects on real biological systems. Your cardiovascular system does not make an exception because you bought something at a pharmacy checkout counter without a prescription slip. Think about this for a moment. Imagine two people. Both have high blood pressure. Both are taking the same blood pressure medication prescribed by the same doctor. Both are eating reasonably well and getting some exercise. But one of them takes ibuprofen 3 or 4 times a week for chronic knee pain. Just a standard dose, nothing extreme, the kind of amount that feels completely routine. The other manages their pain through stretching, topical treatments, and occasional rest. 6 months later, one of them has their blood pressure well controlled. The other is back at the doctor being told their medication needs to be increased because the numbers are still too high. The medication is not failing. The lifestyle is not failing. The hidden variable, the one nobody identified, is that bottle of ibuprofen sitting in the medicine cabinet being used like a daily vitamin. This scenario is not hypothetical. It plays out in doctors' offices across this country every single day. I also want to speak directly to those of you who might be thinking, well, I only take it occasionally, so this probably does not apply to me. And I want to be honest with you about that. For truly occasional use, once or twice a month in a person with well-controlled blood pressure, the risk is considerably lower than for daily or near-daily users. But I want you to ask yourself honestly what occasional really means in your life. Because what feels occasional often is not when you actually track it. The pill for a headache on Monday. Another for sore muscles after the weekend. One more because the weather changed and your joints are acting up. That can quietly add up to multiple times per week without ever feeling like a habit. And if you have high blood pressure, that frequency matters enormously. The goal of everything I share on this channel is to give you the specific, actionable, evidence-based information that empowers you to make better decisions for your cardiovascular health. Not vague advice to eat better and exercise more. You have heard that 1,000 times. Specific knowledge about the hidden mechanisms, the overlooked habits, the silent factors that are keeping your blood pressure elevated even when you are doing everything else right. Knowledge is the most powerful tool you have, and today you have more of it than you did 20 minutes ago. Take it seriously. Share it with someone who needs it. And I will see you in the next video with more information that could genuinely change the trajectory of your health. If this video gave you information that you know someone else needs to hear, please share it. And make sure you like this video and subscribe to William Hart Health, because every single week I am here giving you the honest, clear, potentially life-saving information that can make a real difference for you and everyone you care about.